This time, the chair calls up B. Moorhead, Texas Impact. Good morning.
Morning. My name's B. Moorhead. I'm the director of Texas Impact, and full disclosure, I'm just getting over COVID, and so I'm happy to take the mask off or leave it on as you prefer. CDC says to leave it on.
Yeah, we're good with you leaving it on.
Okay. So I appreciate having the opportunity to offer some thoughts on how Texas can increase Medicaid and CHIP uptake for eligible children. Specifically, I'm going to talk about working through faith and community-based organizations. That is not the only solution, and you've heard a lot of other ones, but I do think it's an important one. Texas Impact has a long track record working with legislators and agencies to deepen partnerships between state and faith and community-based initiatives, including around eligibility and enrollment. Post-COVID, a lot of faith communities in particular are kind of trying to discern what's the best way forward to serve their communities, and I think you do have kind of a large potential pool of community partners. So the testimony that you heard about that program, I think, is really timely. Based on our experience, I have a couple of thoughts to offer. HHSC's testimony on community partners was great. We helped establish that program. We brought the initial legislation that set it up and worked on the establishment of the program for 3 years. One thing that I think the legislature needs to keep in mind is that faith and community-based organizations are a great way to granularly get into local communities, but they're not casual or low-cost partners. On the plus side, they are often the most trusted messengers in their communities, especially for people like reluctant parents who might be in mixed status households, for example. But on the downside, I don't know if it's a downside, but they do require significant training and support. So if you're going to lean into the community partner program, which I think is not a bad idea, just be sure that you're leaning in with the resources the agency needs to make it effective. Also, you heard testimony about outstationed eligibility workers. Outstationed eligibility workers are kind of a top-down approach. They're coming from a professional entity to the local community. Another approach you could consider are promotoras, parish nurses, and parent mentors are more of a bottom-up approach that can do that same job of expanding the role of volunteers or leveraging volunteer capacity. The other thing I'd like to mention to y'all is legislators yourselves are actually uniquely positioned to recruit assisters in your local districts. When we were working on the community partner program, we created House district level maps that overlaid zip codes with high concentrations of Medicaid eligible but unenrolled kids with locations of faith and community-based organizations. We gave those to some legislative offices and they were interested, and we were hoping that that might be a way that legislators could help to recruit community partners. Also, your offices could convene community partners in your districts. And Representative Busey, having said that you think this is going to be a big bipartisan effort of the House, if the House were to commit that all the House members were going to really interact with the community partners in your district, that actually probably would have a measurable impact in a lot of those districts. Data is important, but it's not a substitute for relational organizing or relational recruitment, particularly in low-income areas. The second main point I want to make is that you have two bodies, and at this point I have a handout that I hope that you got. I sent it this morning, okay. The Interagency Coordinating Group and the Texas Nonprofit Council are two bodies that have statutory roles and responsibilities that actually make them be the ideal partner for this committee. Texas Impact worked over several sessions with a number of legislators to set up that framework. They're both convened by One Star, and the ICG, the Interagency Coordinating Group, actually was the first body of its kind in the country. It's in a legislatively established task force or work group or organization of state agency representatives who meet regularly to find ways to build collaboration and coordination between the state and faith and community-based groups. And what I provided you is their 2021 annual report. The legislative charges to those bodies are to identify areas where there are gaps in state services that faith and community-based organizations could fill. So they really are ideal partners for you. And one possibility would be that you could legislatively charge those two bodies to work on this issue, to effectively to make a campaign. I do have to disclaim that I didn't talk to any of those people before I brought this up. So if they think it's a bad idea, I apologize at this point, but I think it's a good idea. My recommendation about that would be that to ensure that they had enough capacity to actually do a credible job on a campaign like that, you probably would need to fund the agency, either One Star or HHSC, to hire temporary staff to work with them because they all are either volunteers or have other full-time jobs working for state agencies. The last thing I will say is I would be remiss if I didn't point out that Medicaid expansion, which Texas Impact has supported stoutly its entire possible time period, is crucial to this particular charge for two well-documented reasons, and I did include documentation to support these points. First, when parents don't have insurance, they're less likely to insure their children even if their children are eligible, and so handout number 2 kind of speaks to that. And second, even if children have Medicaid or CHIP, they're less likely to get care that's covered under those programs, even if they're covered and their parents know that they could get their care if the parents don't have insurance, because insurance isn't part of their culture at that point. Their family doesn't act as an insured family. So we would really encourage you to take a look at Medicaid expansion. Again, I know it feels like you hear about it every session. You'll probably hear about it every session until it happens because there are so many benefits to so many people in the state of doing it. But whether you do Medicaid expansion or not, I think these two recommendations, and especially leveraging the ICG and the nonprofit council, really would be constructive ways forward for this committee. So thank you for the opportunity to testify.
Thank you. Members, are there any questions for the witness? If not, thank you for being here.
Thank you.